Assalamualaikum dear listeners and our students. In last lecture we have studied about the anatomy and physiology of digestive system. Now we know very well about the different organs of the digestive system such as mouth, oral cavity, esophagus, stomach, large and small intestine, etc. In the current slide, we will try to know about the disorders of the digestive system. So let's discuss when the digestive system does not work properly, then what happens in our body. So we will try to start one by one with respect to the organs of the digestive system. So let's start first of all from the oral cavity and its problems. Dental and oral health is an essential part of our overall health. Poor oral hygienic conditions can lead to dental cavities and gum diseases, and also are linked to very dangerous diseases such as and fatal diseases such as heart and cancer and diabetes, etc. If we talk about facts about the dental and oral health, we can say that all these problems occurring in the oral cavity, they are very common in our population, and according to World Health Organization, between 60 to 90% of school children, they have at least one dental cavity. It means the dental caries start from the very early age, while nearly 100% of adults have at least these caries. So there are many steps you can take to keep your teeth healthy. For example, dental and oral disease can be greatly reduced by brushing your teeth with the fluoride toothpaste at least twice a day. Similarly, flossing your mouth and oral cavity, decreasing your intake of sugar, eating a diet high and rich in fruits and vegetables, avoiding tobacco products like smoking, drinking healthy water, and seeking professional care time to time. What are symptoms of dental and oral problems? If anyone experiences from the following warnings or signs, he or she should make an appointment to the doctor. For example, if there are ulcers, sores, or tender areas in the mouth that won't heal after a week or two, if there are bleeding or swollen gums, if chronic bad breath, sudden sensitivity to hot beverages, pain in the oral cavity, pain with chewing or biting, for example, clicking of the jaw, cracked jaw or teeth, and dry mouth. If any of these symptoms are accompanied by high fever or facial neck swelling, it means that the patient should seek emergency treatment. What are main causes of these problems? Let's talk about types of dental and oral diseases. So if we talk about disorders of the teeth and mouth, there are dental plaque and caries. Cavities are also called caries or tooth decay. These are areas of the tooth that have been permanently damaged and may even have holes in them. Cavities are fairly common in any age. They occur when they occur when bacteria, food, and acid coat our teeth and form a plaque. The acid on the teeth starts to eat away at the enamel and then the underlying dentin or connective tissues. Over time, this can lead to permanent damage of the teeth. Similarly, there are some gum diseases like gingivitis. Actually, gum diseases like gingivitis is inflammation of the gums. It is usually the result of plaque building up on the teeth due to poor brushing and flossing habit. There may be actinic cheilitis, that is the inflamed and sore lips and tongue. Then comes herpes simplex. Herpes simplex is caused by a virus known as herpes virus, HSV, herpes simplex virus. This virus cause inflammation in on the around the jaws and around the lips and soft skin of the mouth. Actually, herpes simplex virus 1 and 2, they are known by their names and cause diseases in humans and even animals also. There are canker sores, that is the inflammation caused on the lips due to a viral attack. Contact dermatitis, skin checks for dermatitis. Dermatitis is the dryness, itching and redness that comes on our skin. It might be on mouth and on other soft skin of soft areas of our body, like here on hand the dermatitis is shown here. Candidiasis. Candidiasis is, it's a itching or soreness, pain, might be due to discomfort when, for example, urinating. White patches, candidiasis. Candidiasis shows white patches on the inner cheeks, tongue, roof of the mouth, and throat. The photo showing candidiasis in the mouth here. It, it shows redness or soreness and cotton-like feeling in the mouth. The loss of taste happens during this problem, and patient may feel pain while eating or swallowing. Oral thrush and other yeast infections are caused by an overgrowth of the fungus. For example, the Candida albicans fungus, that is the reason for this oral disease. It's normal for a small amount of C. albinans to live in our mouth without causing any harm. But if their colonies grow in large quantities, they cause sores in the mouth cavity. Aphthous stomatitis. Aphthous stomatitis. Aphthous stomatitis is the common ailment in nature that is painful and cause aphthous ulcers. They are commonly known as canker sores on the non-keratinized oral mucous membrane. This activity reviews the evaluation, and the cause of aphthous stomatitis is idiopathic and multifactorial, but likely it involves activation of the cell-mediated immune system. So they are actually not caused by acute infections and are therefore not contagious, but they may be triggered by local trauma and emotional or physiological stress like allergy or sensitivity, such as sensitivity to some chemicals like sodium lauryl sulfate, for example, which is present commonly in toothpaste, or also present in oral hygiene products, and foods such as cinnamon, cheese, citrus, figs, or pineapple, that is the citrus food, they can also cause this allergy and may result in the aphthous stomatitis. Then comes nicotine stomatitis. Actually, nicotine stomatitis, it is common tobacco-related form of keratosis. This is due to smoking, it occurs as a result of smoking, and is typically associated with pipes and cigarette smoking diseases, and due to the overuse of nicotine, with positive correlation between intensity of smoking and severity of condition. Then comes Kaposi's sarcoma, the inflammation that occur in the inner region of the oral cavity. Similarly, stomatitis, the sore and the inflammation caused on the tongues due to increased acidic conditions of our stomach. Gingivitis, the bleeding gums, we have already discussed about it. Necrotizing gingivitis, another form of gingivitis. Periodontitis, that is the if we look upon the difference between the healthy teeth and the periodontal teeth, we can see here some plaque and tartar, and the tartar is permanent, that does not go away with the brushing or Any cleaning. Parotitis is the disease of swollen parotid glands and is a viral disease. Then comes disorder of esophagus. So let's start the digestive system functions. We have already studied about their functions in our last lectures. For example, some main and important functions of digestive system are explained here. Secretion enzymes, absorption of nutrients through small and large intestine, excretion of waste products through excretory system, ingestion of food through mouth and oral cavity, secretion of fluids like pancreas and liver take part in this function, break down food into small particles where stomach helps to perform this function, and ingestion of the food through oral cavity and again esophagus. So if we talk about the disorders of teeth and mouth. So if we talk about disorders of teeth and mouth, there are some diseases. For example, first of all, let's see them in detail. First of all, dental plaque and caries. What are cavities or caries? They are also called cavities or tooth decay. These are areas of the tooth that have been permanently damaged and may even have holes in them. So cavities are actually fairly common. They occur when bacteria, food, and acid coat our teeth and form a plaque over them. The acid on the teeth starts to eat away at the enamel, and then the underlying dentin or connective tissue become damaged. Over time, this can lead to permanent damage of the teeth. Uh, Next comes actinic keratitis. Actually, keratitis or keratitis is an acute or chronic inflammation of the lips. It usually involves the lip infection and inflammation and on the vermilion border of the lips. But the surrounding skin and the oral mucus may also be affected by this disease. Common symptoms include dryness, scaling of lips, fissuring, edema, itching, and burning of lips. Colitis may be caused by a multiplicity of exogenous factors, and the most common of which are known as ectopic dermatitis, contact irritation or allergy, and chronic sun exposure, and even infection can cause this disease. So involvement of the lips can occur in many disorders such as lichen planus, etc. What is herpes simplex? The herpes simplex virus, also known as HSV, is a viral infection that causes genital and oral herpes and is commonly known as herpes simplex disease. Many people live with asymptomatic HSV disease, which means that they have the virus without even having an outbreak or active episode of herpes. And even sometime the symptoms, the disease is asymptomatic and the patient don't know that that he or she is carrying this virus. Other people might experience occasional infections of small or fluid filled blisters or sores. These blisters most commonly appear on the genitals or on mouth and lips, but they can also show up on hands or our fingers and other parts of the body even. HSV virus can be sexually transmitted, but the virus can also be transmitted in other ways. There's a lot of stigma around herpes, but the virus is actually very common and nothing to get rid of it. It's not very easy to get rid of this virus. Canker sores. First of all, we will talk about dermatitis. Candidas. In cutaneous candidiasis disease, the skin is infected with Candida fungus. This type of infection is very common. It can involve almost any skin on the body, but most often it occurs in warm, moist, and creased areas such as the armpits and groin. The fungus that most often causes this candida is Candida fungus and is known as its name is Candida albicans. Candida is the most common cause of diaper rash also in infants. The fungi take advantage of the warm, moist condition inside the diaper. So the candida infection is also particularly common in people with diabetes and in those who are obese and are fatty. Antibiotics, steroid therapy, and chemotherapy increase the risk of this candida disease. Candida can also cause infection of nails, edges of the nails, and even corners of the mouth. Oral thrush, a form of candida infection, as we can see in this diagram, of the moist lining of the mouth, usually occurs when people take antibiotics. It may also be a sign of an HIV infection or other weakened immune system disorders when it occurs in adults. So individuals with candida infection are not usually contagious for other healthy people, though in some settings people with weakened immune system may catch the infection, but normally it's not contagious disease. Dermatitis. It's a general term that describes a common skin irritation. It has many causes and forms and usually involves itchiness, dryness, or a rash. Or it might cause the skin to blister, ooze, crust, or flake off. Three common types of this condition are, for example, number one, atopic dermatitis, or also known as commonly known as eczema, seborrheic dermatitis, and contact dermatitis. Dermatitis is not contagious, but it can make you feel uncomfortable and self-conscious. Moisturizing regularly helps control the symptoms. And treatment may also include medicated ointment, creams, and shampoos, etc. Stomatitis. After stomatitis is especially related to mouth. What is stomatitis? A general term for an inflamed and sore mouth can disrupt a person's ability to eat, talk, and sleep. Stomatitis can occur anywhere in the mouth, including the inside of the cheeks, gums, tongue, lips, and mouth palate. If we talk about the types of stomatitis, it includes canker sore and cold sores. Let's talk about canker sores. A canker sore, also known as aphthous ulcer, that is the ulcer of mouth, is a single pale or yellow ulcer with a red outer, as we can see here in this diagram, ring, or with a red outer ring or a cluster of such ulcers in the mouth, usually on the cheeks, tongue, or inside the lip. And the second type is cold sore. It is also called fever blisters. Cold sores are actually they are fluid filled sores that occur on or around the lips. They rarely form on the gums or the roof of the mouth, but cold sores later crust over with a scab and are usually associated with tingling, tenderness, or burning before the actual sores appear. If we talk about their symptoms, there is also nicotine stomatitis. Actually, nicotine stomatitis is specially caused due to tobacco and frequent use of cigar or smoking. This is commonly known as tobacco-related form of keratosis, with positive correlation between intensity of smoking and severity of condition. Nicotine stomatitis with the diffuse white change in the palatal mucosa along with elevated papules with red centers. If we talk about symptoms of the stomatitis, for canker sores we can say they are painful and usually last 5 to 10 days. They tend to come back and are generally not associated with fever. While cold sores, they are usually painful, are usually gone in 7 to 10 days, are sometimes associated with cold or flu-like symptoms. Gingivitis. Gingivitis or gum disease, also called gingivitis, is an inflammation of the gums. It's usually the result of plaque building up on your teeth due to poor brushing and flossing habits. Gingivitis can make gums swell and bleed when we brush or floss. Untreated gingivitis can lead to periodontitis. Untreated gingivitis can lead to periodontitis, which is a more serious infection. What is periodontitis? Uh, Actually, periodontitis is also called a gum disease. It's a serious gum infection that damages the soft tissue and without treatment can destroy the bone that supports the teeth. Periodontitis can cause teeth to loosen or lead to tooth loss. This is gingivitis, necrotizing gingivitis, periodontitis. If we talk about some signs and symptoms of periodontitis, healthy gums are firm and pale pink. Let's compare here the both diagrams, the healthy with the periodontal disease. We can see that healthy gums they are tough and firm and fit around the teeth. While signs and symptoms of periodontitis we can see here, they include swollen or puffy gums, bright red, dusky red or purplish gums, gums that feel tender when touched, and gums that bleed easily, pink tingled toothbrush after brushing, and spitting out blood when brushing. Similarly, bad breath and pus between the teeth and gums. Moreover, it include loose teeth, painful chewing, new spaces developing between the teeth, and gums that pull away from the teeth, making teeth look longer than normal, as we can see here in this diagram. And change in the way the teeth fit together when someone bite shows the symptoms of periodontitis. Parotitis. Parotitis is the disease of parotid glands. Actually, parotid in this problem, parotid glands are swelled due to a viral attack. So it's a viral infection that causes inflammation in the salivary parotid glands. Then comes disorder of the esophagus. First of all, dysphagia. It is the medical term for swallowing difficulties. Some people with dysphagia have problems swallowing certain foods or lipids, while others can't swallow at all. Other signs of dysphagia they include coughing or choking, like here when eating or drinking, bringing food back up sometimes through the nose, a sensation that food is stuck in the throat or chest and the patient is unable to swallow the food, bolus, persistent drooling of saliva, and being unable to chew food properly. Similarly, a wet sounding voice when eating or drinking over time, dysphagia can also cause symptoms such as weight loss and repeated chest infections. Esophagitis. Esophagitis is inflammation that may damage tissues of the esophagus, the muscular tube that delivers food from mouth to the stomach. Esophagitis can cause painful, difficult swallowing and chest pain. Causes of esophagitis include stomach acids, backing up into the esophagus, infection, oral medications, and allergies. Treatment for esophagitis depends on the underlying cause and the severity of tissue damage. If it is treated, if it is left untreated, esophagitis can damage the lining of the esophagus and might interfere with its normal function, which is to move food and liquid from mouth to the stomach. So esophagitis can also lead to complications such as scarring or narrowing of the esophagus and difficulty in swallowing. As we can see here, the normal esophagus and the esophagus. The esophagus is much narrower here. Causes gastroesophageal reflux disease. Medicines that irritate the esophagus, for example, non-steroidal anti-inflammatory drugs like NSAIDs such as aspirin, ibuprofen, naproxen, etc., and antibiotics such as clindamycin or tetracycline. They cause they cause gastroesophagus gastroenteritis. Similarly, vitamin and mineral supplements such as vitamin C, iron, a weak immune system, radiation therapy, and allergies. They are most common causes of this problem. And common symptoms of esophagitis include heartburn, pain when swallowing, trouble swallowing food or liquid, chest pain, cough. Then comes diagnosis. How esophagitis is diagnosed. An endoscopy. During this test, the doctor puts a thin flexible tube down the throat to look at the esophagus. This test also let the doctor get a sample of the cell to test for infection. Sometimes a small piece of tissue is removed for a biopsy. And using a barium swallow, this is an X-ray of the throat and esophagus. This is the process shown for barium swallow X-ray examination. Where a drink containing barium is swallowed, a series of X-ray pictures is then taken of the progress of the barium through the upper upper respiratory tract, digestive tract. Normally, the outline of the radiograph is smooth, but the presence of a cancer can cause an irregular shape. What is its treatment? Do not smoke or use smokeless tobacco. Antacids such as omeprazole or ranitidine with the medicines that can help and ease out digestion process. If esophagitis is caused by an infection, you may need to take antibiotics or other medicines. And if the patient has esophagitis caused by food allergy, provide corticosteroids can cause harm, can cause relief. Then comes achalasia. Achalasia is a condition in which muscles of the lower part of the esophagus fail to relax. As we can see here, the lower part, lower esophageal muscle or lower esophageal sphincter becomes fail to relax, preventing food from passing into the stomach. So the food becomes choked here as compared to the normal food or normal esophagus. We can see here the condition. What is the cause of achalasia? In most cases, it is caused by loss of the nerve cells that control the swallowing muscles in the esophagus. Doctors and healthcare providers don't yet know why actually these nerve cells are lost. And in rare cases, achalasia is caused by a tumor. It's a disorder. So we can say that it's a disorder of the esophagus, the tube that carries food from mouth to the stomach. This condition affects the ability of the esophagus to move food into the stomach. If we talk about its symptoms, the most common symptoms of achalasia is difficulty in swallowing. Patients often experience the sensation that swallowed material, both solids and liquids, get stuck in the chest. This problem often begins slowly and progresses gradually. If we talk about its exams, there are some other symptoms like backflow of the food, chest pain, cough, difficulty in swallowing, heartburn, unintentional weight loss. The tests and examination, physical exam may show symptoms of anemia or malnutrition due to non-supply of enough food. And the test include, and the most common tests include upper gastrointestinal X-ray, esophagogastroduodenoscopy. This treatment is also, this test or treatment is also very important in order to find out and diagnose this disease, achalasia. In this case, a tube is inserted in the stomach and endoscopy is performed. In case of treatment, the goal of treatment is to reduce the pressure at the lower esophageal sphincter. So, injections of Botox help to relax the sphincter muscles. Mainly, achalasia treatment focuses on relaxing or stretching open the lower esophageal sphincter so that food and liquid can move more easily through the digestive tract. Specific treatment depends on the age, health condition, and the severity of the achalasia.